So, Larry, walk us through what advice you would give to a healthcare PMO who is struggling with intake and prioritization. How would you coach them to help them avoid, just saying yes to the loudest voice or potentially making decisions that are not very strategic for the organization?
Yes, Natalie, you got it. That very clearly is a common challenge we've seen with a number of healthcare organizations. Without clear intake processes, these projects pile up fast and resources can end up getting stretched way too thin. So what I would do is I'd establish a standardized intake and prioritization framework. Prioritization is unique to each individual organization, so it really varies. But overall, I would focus on what is the overall strategy link of this idea to the strategy of the organization or to the individual department. How does this idea relate to regulatory or compliance needs? What is the value that this project is going to bring to the organization or department? And what's your capacity to be able to support it? Those are key aspects that you need to focus on. Second, I would establish portfolio governance. Now, portfolio governance, there really needs to be multiple layers. At the very least, you'd have a department level governance and an executive level governance. The department level governance should be focused on projects that were within their purview. It's impacting their resources. But the second that you have projects that are coming in that impact multiple departments, and given the nature of healthcare organizations having siloed departments, one department can't really speak to the impact to the other. So that's where you need to have the executive level weighing in and saying yes or no to projects that are impacting the overall organization, especially those that are highly strategic, have extreme value, or even capital initiatives. Within those portfolio governance, I would also establish a scoring model so you're having objective decision making. The decisions should be based off of the same criteria I just mentioned, but basically you should have a scoring model within your tools that say, how does this idea relate to the strategy, the roadmap for your team, for your organization? What's the value and return on investment that you're going to get? How quickly will you get that value back? Should I implement this project today or should I wait a few years because I'm not going to get the value back immediately? What's the risk I'm going to take with this initiative? Risk could be what's the risk of doing the project, but as well as what's the risk if I don't do this project? Am I going to have a compliance violation? Is there a licensing risk? You need to consider those risks as well and make a decision as to what moves forward or not. And then there's capacity. You want to make sure you have resource capacity, and that's just not the people resource. You want to look at, do you have the budget, the financials necessary to pay for this? Do you have the tech and environments that are necessary to support this initiative, as well as do you have the subject matter experts and the SMEs, the business and technology experts necessary to deliver the overall delivery for this effort. Once you have that established, you want to make sure that you also have a live dashboard that ties this all together and shows the strategic goals, the mapping, and shows transparency of how these projects that move forward, how they relate to those strategies and the overall scoring. So then the governance team basically has ammo. They have that transparency as to why they said no to some initiatives and yes to others.